People are told once you have neuropathy, well, our Western medicine civilization world cannot do anything about it. They're not incorrect. They're not wrong. Yes, our medical model can no longer do anything about that because there is no pill, right, that can fix neuropathy. All right, there's no medication that can fix it. Surgery, what's surgery going to do? Nothing, right? It's going to cause more scar tissue than anything else. Surgery's not going to help it. So if they can't reverse diabetes and you can't really help with neuropathy except for taking drugs that covers it up, and most drugs for neuropathy is actually anti-seizure medications where they actually start turning off your brain, well, of course, ultimately when they start turning off your brain, eventually you're not going to feel what's actually in your feet anymore. And that's how neuropathy starts settling in worse and worse and worse. For my grandmother, well, what happened with her was diabetes cut off the blood flow. Right? Cut off the blood flow furthest away from your heart, cuts off the oxygen. From there, you start losing oxygen furthest away from your heart, which is your feet, toes, your ankles, eventually up the calf. When it gets bad enough, it attacks your hands, your fingers, all the way into your elbows. Well, there is also the other side called autonomic neuropathy, where patients used to have problems with the colon. You can't have intercourse anymore because everything is becoming flaccid and you're not getting enough blood flow to your sexual organs, right? So intimacy becomes a problem as well. Colon becomes a problem. So now digesting food, irritable bowel syndrome, constipation, diarrhea, flipping, flopping, that becomes a problem. Your bladder starts becoming a problem as well. So this is called autonomic neuropathy, and areas that need the most blood flow will be affected first, right? Then your heart and lungs, which is closest to your heart, right? That gets affected last, but your digestion, your intimacy, bladder control, colon control will already be affected by the time it gets that bad. Well, my grandmother, how it happened was she didn't get enough blood flow to her feet. She got a cut. The cut turned into an infection because it wasn't healing, it became an ulcer. Now the infection goes deeper and deeper, infected to the bone, and now they have to amputate because the doctors don't want the whole leg to get infected as well. So they have to cut where you're still getting blood flow. You're not losing all the blood flow yet. So they have to cut a little bit higher than where your neuropathy is because it ensures that they're going to get blood flow. But what happens? Eventually it gets worse. She never lasted to the point where they had to amputate more or a second time, but when they amputated the first time, they had to amputate just above the ankles. Well, if neuropathy symptoms doesn't get improved and her diabetes continues to get worse, which there isn't a treatment for diabetes, right? Now they have to cut higher and higher and higher. And eventually people walk around with everything but their knee. Right? Everything from the knee below has already been amputated. And you see that among a lot of diabetic patients. And the world has to know the truth now. You have to know the truth. People around our community has to know the truth.